as the run of the show, and then the questions from the panel. Yeah, so I'll just leave that there.
Hello. So in the interest of time, we're starting out. And this is the second last time you're hearing me, so bear me out. Just a very brief hi before I hand over to Ariana, who's going to take us through the session. It's going to be a panel discussion around policy approaches and how we integrate these principles and priorities within policy, within existing processes that we're all already probably aware of. If not, the speakers will give some introductions to it. So Ariana, over to you.
Thanks so much, Shuchi, for that little introduction. Welcome, everyone. I'm sure we'll still have more people trickling in, but thank you all for being here this morning. So we're going to start this session with a panel discussion. We're actually still waiting on one panelist, so hopefully he'll be joining us shortly. Yeah, thanks, Kara. And I'll just tell you a little bit about how this session will run while we wait for our last panelist. So we're going to do the panel discussion, then we're going to have some time for question and answer from all of you to the panel. And then we're going to break into some informal group discussions. And we'll have some questions on a slide for that. And then and one of the panelists will be in each of those little small groups. And then the panelists will report back the top priorities that emerged from those small group discussions, and then we'll wrap up from there and go have lunch. So hopefully it should be engaging and a nice way to kind of spend some time right before we break for lunch on our last day together. Okay, so welcome. I'm going to introduce the panelists and then hand over to each of them to answer a couple questions each. Hopefully we'll have time for 2 questions for each of you. Thank you all for being here this morning. Let's see if I can, no, okay, I'm not gonna get too fancy. Okay, so we have 4 panelists. The first one that we're gonna hear from is Mr. Joseph Muturi, who I work quite closely with at SDI. He's chair of the board of SDI and a community leader from the SDI affiliate in Kenya. Hi, Muturi. Hi. Do you have a mic there? I think there is one that's also on. So we're talking a bit this morning about how we can take some of what we've learned over the past couple days and what we discussed this morning, the principles and priorities for resilience and for resilience evidence, and bring those into policy spaces. So one of the questions that I wanted to ask you, with all of your experience that you have working with communities and what you've been listening to over the past couple days, what would you say are some of the main elements of quote-unquote inclusion that are required to ensure that evidence informs the policies that actually are made?
I thought you were finishing with the introductions.
No, sorry. We'll go. They're up there, so everyone can see the brilliant faces.
So I think when you talk about inclusion, basically I'm looking at the context of the constituency that SDI works in. So we are talking about people living in informal settlement. We are talking about informality. We are talking about social and economic exclusion. And I think my experience, having worked across the continent, in Asia, in terms of trying to find some level of social inclusion for slum dwellers, one of the things I think when we are looking at addressing issues of policy, I think the most important for me I said it before. So when it comes to city, when it comes to academia, when it comes to civil society organizations, this something called community engagement, community participation. They'll have one page and they get to sign their names and they go home. And I think for us, we have been pushing for beyond the engagement, beyond the participation. We are looking for a solid partnership. We are looking at a 50-50 relationship where we see ourselves as partners in trying to address some of these urban complexities, some of these urban challenges, basically for slum dwellers. And then when you look at, let's say, for example, building evidence, we have seen a lot of institution, government coming in to collect information. Sometimes it's very extractive. They come, extract, and go. But for us, communities want to be included right from the design to the implementation stage. And for me, building evidence that is not actionable and building evidence and collecting evidence for the sake of evidence only is absolutely useless if it cannot be used. So for me, building evidence that end up being actioned, building evidence that also informs policy, because I think at the end of the day, you have to look at what are the policy gaps. And specifically in Africa, there are so many policies, but most of them are not pro-poor. Most of them do not favor people living in informal settlements. So we collect evidence also to look at how do we bridge the gaps, how do we lobby for these policies to be improved. So me, inclusion will be that. How do we involve communities right from the design to the implementation stage?
Thank you. That actually leads really nicely. I'm going to go this way as opposed to that way. And it leads nicely into some of the questions that I wanted to ask to you, Julio. Your surname, is it Araujo? Is that? Araujo, okay. Who's a program manager at South-South North. So one of the notes that I have here about your work ties really nicely into what Muturi was just talking about, bridging the research to action gap. And so building off of what was just spoken about, how do you think we can reverse existing methods of evidence collection and curation and consider different methodological approaches that are more inclusive and consider different types of knowledge systems, which ties in really nicely, I think, to what Muturi was just speaking about?
Thank you. So perhaps before I get into that, just a bit of a background of where this comes from then. So I am the deputy head of the Adaptation Research Alliance Secretariat. And really the alliance was formed to bridge this action research gap. And we work with over 180 organizations, from funders to grassroots organizations as well. And we do engage with our membership in terms of identifying what is working and not, in terms of bridging the research to action gap. And we have a set of principles, the Adaptation Research for Impact principles, that each member is asked to endorse and track against. So we have learning that kind of falls into this particular process. So on the actual question, I think the short of it is through co-production. And that's really the lens that we've decided to take in the Alliance. So in the ARA, we are tackling this issue through what we would call internally the co-creation spaces. And this is really, we run a series of co-creation spaces that are intended to generate new knowledge, to generate this knowledge in collaboration with communities and various stakeholders throughout the various levels, including the donors, and bringing everyone into this boiling pot, because you need to have the views and perspectives of everyone involved in order to get the correct knowledge coming out of it. And the intention of this is to lead into new program development. So it's co-creating with the communities and academia and the NGOs and various other stakeholders within that system to create these Global South programs that are rooted in the context and needs and evidence that is coming from the communities itself. This does also include multiple feedback loops, and really the intention here is to make sure that these programs and the way that we gather evidence is rooted in the needs of the people on the ground. So this really ensures that we don't land up with research calls that miss the real challenges and the focus of the peripheral issues that are of interest externally, often from the donor side. So within that, we do have examples of these through new programs and co-creation spaces on urban resilience, smallholder agriculture, and LDC University capacity to support adaptation action. And the idea is that this kind of bottom-up approach to the program design allows us to have more impactful and more kind of relevant research and programs that are actually implemented. And really the way that this process is designed is it kind of links back to those principles that we have. For instance, one that's quite a clear linkage is on that research is needs-driven, solution-oriented, and leads to a positive impact on the lives of those at risk from climate change. So it's really about taking up that bottom-up approach and through a co-production lens.
Thanks, Julio. That's great. I'm going to move to you next, Sarah. Sarah Berry is works as a strategic advisor with USAID in Ethiopia. So the kind of entry point for the questions that I wanted to ask you is around connecting evidence to policy and programming for long-term development objectives. And this is obviously based on your work on the ground in Ethiopia with USAID. So what would be the relevance of working with some of the evidence principles and priorities that we discussed this morning, in the session this morning, to inform policy making, especially in volatile areas that you work in Ethiopia?
Thank you, Ariana, for this opportunity to share my perspective. As a field person who has spent most of her professional career working overseas, I consider myself one of the end users of the knowledge and analysis that is produced by so many of you in the room. So I hope that by sharing my perspective, it will help the producers and generators of this knowledge and data better understand what some of the needs are of people like me, field operators, USAID managers, project managers, and I hope you will be heartened as you get a glimpse of how your research is being put to good use, how we are at USAID taking and applying the evidence to inform policy and programming. And I just want to maybe start by sharing 2 lessons learned from the COVID pandemic. As we all know, some countries took very restrictive measures and completely closed down their economies. The schools were closed. There were certainly travel limitations in place. Other countries, we saw varying degrees of a lockdown or restrictions. But not only did these restrictions have a deteriorating impact or effect on resilience, they also limited our ability to conduct routine monitoring. Planned baselines analysis were simply not feasible. Some assessments were postponed or ultimately canceled. So during a very long, prolonged period, I think we had to rely on different methodology. We had to, in part, conduct desk reviews or literature reviews. And one lesson that I would say has emerged is that we felt it would be absolutely unconscionable to conduct monitoring or assessments in shock-affected communities without also delivering assistance. That would have absolutely violated the principle of do no harm. So the 2, this is what I'd like to say, the 2, assessment and assistance, they need to go hand in hand. Where I'm currently serving in Ethiopia, many parts of the country have been inaccessible for extended periods of time due to active fighting, insecurity, and in these areas we've had to rely very heavily on partner performance reporting alone. And in hindsight, I think that this could have been partially mitigated by having third-party monitoring mechanisms in place at the beginning. We do have some of those third-party mechanisms in place now, but it has taken a good 2 years to get those awards and contracts active. So as I said, I'm serving most recently in Ethiopia, and in this context, we're operating in a very complex, dynamic environment, and it requires adaptive leadership from all stakeholders, whether it's donors, development partners, humanitarian actors, our host country counterparts. In this messy, constantly changing environment, many of us are really fighting to make sense of this new reality. There's a very strong drive to push towards certainty. You know, we think of the environment as very much VUCA, right? It's volatile, it's uncertain, complex, and ambiguous. And our senior managers are also pushing to gain greater clarity and make sense of this new world. But I'd say we need to also caution ourselves of the danger of reaching hasty and faulty conclusions. Under these circumstances, I think what I found is that the use of inquiry and probing questions can be very helpful to fully explore and unpack a problem. As we go through that inquiry process, we're really we're just sitting with the problem. We're not rushing to solve it. We're sitting with the problem, we're peeling back the layers, and in doing so, we can sometimes discover that the real problem, the root problem or challenge is something very different from what we initially thought at the outset. So maybe when we come back around, I'd like to share a few examples of different learning approaches that have helped us at the USAID mission adapt our programming and our policy to be more inclusive and is helping us to better serve populations in need. Thank you.
Thanks so much, Sarah. Yeah, that's such a great point. Okay, Kai, over to you. So Kai, do you pronounce your surname Tushin?
Yeah, that's correct.
Okay, great. Thank you.
German is tricky.
My surname is also a little bit challenging, so yeah. Okay, Kai is an advisor at GIZ and is here representing the Insure Resilience Global Partnership Secretariat and the Global Shield Secretariat. So you have 2 hats on today, from as I understand it. So with your Global Shield Secretariat hat on, could you maybe tell us a little bit about the ambition of the Global Shield, which was launched at COP27 last year, in terms of its aim to reduce climate risks, and how resilience evidence principles help inform the framework that you're working on?
Sure.
Thank you.
Hey everyone. Thanks, Ariana. Yeah, I'm Kai. I work for this secretariat that currently has both those hats on, and maybe I allude a bit on that, how those 2 hats work together before I jump into your question. So Insure Resilience as an initiative was started by the G7 under the German presidency in 2015, and had the objective to strengthen people's resilience through the implementation of climate and disaster risk finance and insurance. That summarizes a lot of things. And since then, a lot of initiatives have been added to that partnership. A lot of funding vehicles, a lot of private sector entities have joined the partnership, so that in 2022, last year, we had 475 ongoing projects in 128 countries, catering 190 million people with insurance and risk transfer products. And the Global Shield basically is a reform of that architecture. So under the latest German G7 presidency, there was a strong push to make this whole ecosystem more coherent, to make it more systematic, more sustainable, because we realized in many countries there was a lot of work going on by the very different initiatives, all working on insurance, but there was a big lack of coordination among them, and there was also very little country ownership over what was going on. So with the Global Shield, we're going to introduce a country-by-country approach, where the starting point is an in-country process where, first of all, stakeholders are gathered, affected communities are gathered, there is a stock taking of what's there in terms of insurance implementation and also in terms of risk modeling and risk assessments. And that can come from many from many actors, not necessarily insurance-related actors. At the end of that process, the country will be able to express their gaps and demands in terms of insurance implementation and express that to the Global Shield funding architecture that is going to kind of support with targeted projects to close down those gaps. Yeah, of course, the question of ambition is an important one, and we have been doing evidence work in InsuResilience from the very beginning. We have a 19-indicator monitoring framework. We're counting beneficiaries because that's like the political currency we kind of have to work with. We also have a principled approach. I found that quite interesting to see those principles coming up and like check them against the principles that we have. So the catalog of principles that we have is called Pro-Poor Principles. And there are 5 lead principles with a lot of sub-principles, but the 5 are impact, quality, ownership, complementarity, and equity. And based on that, we grounded all our monitoring and evaluation and impact assessment work. And in 2021, we also published an evidence roadmap, which we generated with all the stakeholders in the partnership. And that's basically an identification of the research frontier. So we got a catalog of 50 priorities and questions across 6 chapters in that roadmap. And now in our work in the Secretariat, we are trying to foster research work to fill those gaps on the one hand. And we're also collecting all the evidence and putting it all together on one interactive visual on our website so that people can scroll through the questions and then see the journal articles and receive tiny digestible summaries of what's going on in there, so that the evidence is not ending up in the drawer. It's actually, we actually carry it to the policymakers also. Because I really like Joseph's point on that evidence is useless when it's not leading to action. So that's really the bridge we're trying to make with the roadmap. And we're definitely going to continue that work under the Global Shield as well. So everything that the Global Shield is doing is basically a reformed continuation of what was going on under InsuResilience. And yeah, I'm here to learn about the wider resilience principle work that is being done. So that's why this session this morning was so important for us. And we hope to be able to combine like the principles we have with the principles we see. And we're going to develop a new ambition framework for the Global Shield next year. So the current ambition framework is running until 2025, and then we're going to take stock this year and then come up with a new one, with a new timeline also. And for that, we're currently pulling together all the different sources that can be useful for such a framework. But it's also our task to make it digestible for the policymakers, but that's maybe something we can allude on in the second question.
Okay, great. Thank you so much. We're going to come back to you, Joseph. So in your experience with urban poor communities and policymakers, which you have extensive experience with both, how can different evidence users, which I would say both and many in between would be evidence users, engage in the co-production of evidence, especially those who are not traditionally considered as legitimate sources of data or knowledge? But what I would also ask you, so there's one, how can we produce evidence and have evidence produced in maybe less traditional ways? But also I think something that's come up this week is how can the community-based knowledge producers or the less traditional kind of evidence producers really connect in meaningful ways with the evidence users, particularly policy makers and decision makers. Yeah, and make those connections and make them in ways that actually do lead to action and policy and change.
Yeah, I think part of it, and this is based on experience. As you are aware, SDA has been involved, first of all, was to stop evictions of informal settlements, to fight demolitions, and to address land tenure issues and housing issues. Initially, when communities used to go to City Hall, to their city managers, to their mayors, and probably say, we are being evicted, so how can you help? One of the questions that came across was, how many are you in that settlement? And you find that communities didn't have that information. That's why, from the basis of SDIA now, building the capacity of communities to collect their own data. But the problem didn't end there. Yeah, they took up a pen and pencil, they rate how many women, how many structures, how many toilets, how many. So they go with that information. But in some instances, it was when you present it to your city managers, it was garbage in, garbage out. It was not taken seriously. But then again, we now started partnering with academia, with universities, and there was some level of legitimizing that data. When the city managers had that this data has been collected in collaboration with University of Cape Town, University of Nairobi, they took it more seriously. But then again, we went even further. So instead of you sitting and waiting for communities to bring you data that they have collected with this university, why don't we partner together? One of the things, is that most cities don't have adequate information. They don't have enough evidence to address some of the challenges of the informal settlements. So we said, why don't you just, instead of sitting here, yes, the universities and working with civil societies, NGOs, they gave some level of credibility to the data that we presented. So moving on further, we said, instead of you sitting and waiting for you to bring all this information, we have mapped out the boundaries, we have done a profile, how many toilets, how many people use one toilet, how many taps, how many people use one tap. Why don't we partner together? Why don't we, from the word go, a city becomes a partner in this exercise? We will provide the labor, we will provide resources, because most cities, they will claim we don't have enough money to collect this kind of information. The settlements is too big. So why don't we partner together? And then again, that also added some where the city, the communities, civil society, and universities, they co-produce the tools of collecting data. So the city manager won't sit, the director of planning won't sit in his office and then they start criticizing this data. They won't. So that's a strategy that we learned. So why don't we develop the tool together? They're very simple. And we ask the city, what kind of information do you want so that you're able to provide services, so that you are able to provide a budget for this community? And we could develop that process together. And for us, it has worked. And they become part of that process. They become part of the data collection. They become part of the analysis. And at the end of the day, so this data also is co-owned by the city. They can use it for whatever they want to do. And then the community can use this information in terms of prioritizing what their specific needs are, what are the low-hanging fruits, what are the long-term, whom do we need to go to address the water issues, the housing issue, the land issue. So I think that is, from our experience, it's co-production. Somebody mentioned co-production. There's the co-production. There is looking at ourselves more as partnerships, more as partners, not consumer, not beneficiary. We remove this issue of beneficiary. We look at ourselves as trying to address some of these issues at the city level.
Thanks, Joseph. Yeah, that makes a lot of sense. And I think, again, leads very nicely onto the next question. So, Julio, in your experience, how can we link up even some of what Joseph was talking about, the evidence emerging at the local level, to global priorities? So Joseph spoke a lot about, maybe in a city context, but I guess what I'm wondering is, how can we take that kind of up a notch and have what's happening at the local level, even that city level experience, really informing global priorities and global policy processes?
Thank you. Okay, so this does seem to be something that has really been driven for, but the big issue with this is that there's still quite a big discrepancy between what is happening on the ground and what is happening at the national and global levels. So for instance, in the ARA we did engage with all of our members to feed into the global goal on adaptation and the global stocktake. And this really was that process to feed in the views from our members and on the ground into the UNFCCC processes. And really what we found is that there's still a huge disconnect between the conversation about national reporting and the reality of what is actually happening within those communities. So a lot of this work does not really reach that's happening in the communities, doesn't really reach the national reporting systems. Or it's not measuring what the international processes deem to be significant. So really this also comes out of a conversation, well, several conversations that were had at this morning session, in that the evidence at the community level shouldn't have to go through these layers of retrofitting to align with the national policies and plans. If we do that, we lose a lot of that nuance that comes at that level, and a lot of the truths of actual resilience and evidence on the ground then tends to kind of disappear slightly. So the priorities in this case, when we're having these discussions, it really should start with the communities. It really needs to be this bottom-up approach. And then it's really a question of how do we carry that across to the national and global discussions. There's that disconnect. We can look at it, for instance, there's metrics like the number of people that are made more resilient, and there's numbers like 70% of the people are made more resilient. And you have that at the global scale or national scale, and that's really great. But at the household level, you're looking at things like household income. And those two do not really speak to each other very well. So how do you carry that across? It's that issue around alignment. So if we don't reconcile this disconnect, we really risk missing out on really understanding what is it that we're measuring and how is it, and what we are measuring is actually doing on the ground, and how we are collectively doing when we're talking about resilience. Another thing to consider is that there is a difference between evidence and data, and often the conversations that I've heard throughout the conference have been about gathering data and not necessarily using data to capture the narratives that explain resilience. And that's something that I think is quite fundamental for us to capture appropriately within these processes. So it's for some of these reasons that, for instance, the ARA supports more of a learning-focused approach to build the capacities to measure adaptation and resilience at community and household level. However, with something like this, there is a significant barrier when taking this kind of more bottom-up approach. And feeding this international systems and the global systems is going to require a significant amount of investment. And it's the same for creating the kind of better linkages between national government and the research and the broader community. We've seen from countries that have taken time to engage, that have taken the time to be part of these engagement forums, that they really can unlock cooperation, and they really can bring something valuable to the table, but it is essentially, it comes at a price, and that is very difficult to kind of program across.
Thanks, Julio. Sarah, you were going to speak a bit more about inclusive development, I believe. So how do you operationalize inclusive development, especially in conflict-prone areas? And how do you ensure the inclusion of some of the populations you mentioned, women, youth, and other marginalized groups?
Yeah, great. Thank you for that question. And it gives me a chance to share 3 examples of learning approaches that have helped the USAID mission in Ethiopia adapt its programming amidst enormous challenges, including a 2-year civil war, a severe drought hitting much of southern Ethiopia, And so there are 3 examples that come to my mind that I like to share as like very practical, where we've been able to take use of the data and use it to inform, adapt our programming. And the first is the refine and implement approach in the first year of the Bureau of Humanitarian Assistance funded RIFSAs. These are the 5-year development programs, resilience food security activities that are carried out through a very deliberative co-creation process. In the first year, that includes rigorous assessment and surveys that will help to inform the following 4 years of those activities. A second example is a developmental evaluation of our DRM portfolio. And the third, and I'm going to spend a little bit more time on the third one, is an evidence gap analysis of our resilience activities. And this gap analysis included both our Feed the Future activities and our Bureau for Humanitarian Assistance, RIFSAs. And the evidence gap analysis reviewed and coded about 250 activity documents, so it is by no means a mega analysis, but even with those limitations, the review allowed for an examination of resilience to shocks, drought, conflict, COVID, other health shocks that many populations in Ethiopia were experiencing in the past 3 years. And this evidence gap analysis helps USAID and it helps our implementing partners identify what has worked well, what has been examined through the existing evaluations and research, and where there are still gaps in evidence that could present new opportunities for more research. And through the evidence gap analysis, we were able to code a finding if it was supported by multiple data sources of generally strong quality. We were able to find findings where there were a few data sources of strong quality or multiple sources of lower quality. And then thirdly, there were areas of more limited evidence, maybe 1 or 2 sources reporting a particular finding related to our resilience intervention, where the information is complete, conclusions cannot be easily derived. So this evidence gap analysis allowed us to, whether it was a finding around asset building to make transitory poverty escapes less likely, or a financial inclusion activity, social cohesion, or early warning and early action interventions. This gap analysis helps USAID to direct our resources to try to fill some of those evidence gaps, and certainly double down on approaches where there is a larger body of strong support, quality evidence coming from multiple sources. Am I doing okay on time?
Yeah, a couple more minutes.
Okay. Trying to be very respectful of time. There's always a preponderance of examples that can be shared. I think in addition to the developmental evaluation of our DRM portfolio, this evidence gap analysis I shared of our resilience portfolio, some of the other methodologies or tools that we found very useful are the RMS, the recurrent monitoring systems, and the evaluations we've conducted of our crisis modifiers. We've approved a high number, at least 20 some crisis modifiers of our development programs, where we allow those activities to pivot some of their resources, usually a very small amount of resource, to respond to an emergency shock that was affecting the community that was being targeted for the development intervention and could have jeopardized the longer term outcomes of that program. So altogether, the crisis modifier evaluations also serve as another entry point that we can examine, we can understand a problem or shock, and we can work in collaboration with our implementing partners to adapt programming to make them a little bit more responsive to that shock, and also still preserve the longer term development outcomes that are desired. Thanks.
Thanks, Sarah. Yeah, lots of interesting stuff there. We could have like a whole panel on just each of your set of issues that you're all talking about. Kai, turning to you now for our last question from this panel for now. So this question is about how we bridge the divide between practical reality, which we've heard quite a bit about from a couple of our panelists, and policy level silos, which I think have also, that issue has come up in a couple of sessions I've been in this week. In your context, for instance, working on climate risk finance and insurance, in the policy context, this has been recently relegated to more of the loss and damage space versus adaptation. So this has implications on how the ambitions are set and carried out. But in practice, those two are part of a continuum. And on the ground, practically, they're often addressed in tandem, adaptation, loss and damage. We would welcome your thoughts on how we can bridge that, and especially with the evidence that we have on that.
Sure, yeah, thanks a lot. So I think in this room and in the discussions we had, we really know that resilience is absolutely cross-cutting to loss and damage and adaptation.
Yeah.
But when I started working for the Secretariat a few years ago, positioning climate risk finance and insurance in the loss and damage space was really a taboo topic, which is really odd. And then last year, under the German G7 presidency and all this process of coming up with the Global Shield and advising German ministries on positioning it in the G7 agenda, this really shifted. And I think we all saw that at COP last year, that risk finance and risk transfer are now like not the silver bullet, but cornerstones to addressing loss and damage as well. So we're very happy about being able to make that bridge now. But at the same time, this process also comes with a lot of pressure, a lot of rush to deliver insights. So for example, for the G7 Leaders Summit last year, we had, I think, 5 lines of text to summarize everything on the Global Shield. What can it do? What is it all about? And what is the ambition? And it's very hard to boil things down so much, and there's also no time to generate proper evidence, to observe implementation for an amount of time, to come up with a reasonable statement when you're just asked to do that in 2 weeks. So you have to have all your evidence together when this starts, and that's what we're trying to do in the Secretariat. And then on this task to come up with one sentence or one number to sum everything up, I mentioned the 190 million beneficiaries that we estimate to have in InsurResilience Global Partnership. I would say the methods we have to come up with that figure are more or less robust. So they're not perfect, but they are the best available we can come up with. But at the same time, we have to ask ourselves the question, how does life change for those 190 million people? So in our case, people are counted as beneficiaries when they hold an insurance policy. Many people in this world hold an insurance policy without knowing. So they're not aware. How is their life going to change from that? It's not. And that's really where our evidence roadmap work comes in. How does financial behavior change in non-payout situations? How do we tackle insurance awareness? How do we tackle financial literacy when working with this solution? And we generate this evidence, we collect this evidence, and then we really try to balance things out. So we got the 190 million on one end, and we got the evidence roadmap and all the rigorous evidence and all the details on the other end. So if people need one sentence, they get one sentence, and if they need a cohesive report, they get such a report. So we got the easy, tangible results for policymakers, and we also got deeper and rigorous insights to enable learning for implementers, to hold the Global Shield accountable for civil society. And that's really also our task, because of course we do have a lot of stuff that's going on, but we need to get, same as the Global Shield, more systematic, more coherent, and more sustainable in generating that evidence.
Thanks, Kai. We're going to take a few minutes. We started a little late, so we're running a little late, but we still, I think, have a few minutes for a couple of questions from all of you. So let's say like 10-ish minutes, maybe 12 if we're lucky. So are there any questions for the panelists from the floor? I think we have a couple of mics. Maybe the AV team can just, yeah, thank you, Shuchi. Just wait for your mic so that we can actually hear you, please.
So, Ariana, probably while we are still waiting for the mic, just a quick one. I think when it comes to evidence, there is enough evidence, but also there's a lot of duplication. Duplication. So it goes to every institution, every civil society organization, when they want to invest in a community, when they want to make an intervention, they collect their own data. They don't look, for example, probably GIZ has collected data on ABCD. How is GIZ data accessible? So what I do, I'll make a budget, go collect my own for the same thing. And I think that is part of the challenge where there's a lot of data, but we are not actioning this data and we are not making our data accessible to other partners who want to invest in the same community. So there's a lot of duplication. Everybody wants to collect evidence to do their own little thing somewhere. So that's why probably the emphasis on co-production is very important.
Thanks, Muturi. This gentleman here, and then Lucia will come to you.
Thank you. Building on what Joseph actually mentioned around the fragmented way of really investing in the resilience-related projects, it raised a fundamental question. And what we tried especially to address question around open data access. We had a meeting in Nairobi where we invited, with the support from UKRI under the Tomorrow Cities project, which brings together close to 4 cities globally. And one of the fundamental questions which emerged is some of the institutions are willing to provide access to their data. Some have to still seek approval, those processes, and it's such and I think it's something that as this consortium that we need to address as we go back to the Africa Climate Summit in Nairobi, where the high-level policymakers will be present and the practitioners is, what are some of the questions we should ask them as non-state actors, as researchers, that we can trigger that debate around opening the data and linking with the public and research and NGO or researchers system. My question to Julio is, you mentioned about reporting, and the first day I was asking, who has seen a reporting framework on adaptation at the sub-national level? Please raise your hand if you have ever seen. And this is the challenge. We have been engaging the directors in Kenya at the sub-national level. We have even a common WhatsApp group. And Kisumu County in Kenya is doing independent reporting. And this is the question. If we don't focus on really engaging these middle-level policymakers who are also linked to the communities, then we are going to address our own issues independently. And then we miss what the subnational governments are doing also with the local communities. So moving forward from here, I think based on the projects, of course, which we are also implementing as Africa Research and Impact Network, we just got one which is focusing on 14 subnational governments in Kenya, and one is on focusing on adaptation metrics. Is we are going to convene, especially in Nairobi, and Joseph, we are going to bring you on board. We really discuss with the subnational governments. What is the kind of framework, reporting framework, so that when we move to talk about like reporting or metrics, we understand their priorities. Thank you.
Thank you. Was there a question there for you, Julio, or should we, I think let's move on to the next one.
Yeah, I can definitely agree with that.
Okay, great. On the same page. Lucia?
Yeah, thank you so much. I really liked your last point, Joseph, about, yeah, we have enough data. I was just wondering, since we have two donors at the, on the podium, and then somebody representing communities, where should coordination happen? Because there is so much duplication, replication. So should it happen, especially when donors are funding multiple activities that are repeating each other, should the coordination rather happen and the finding out so that we don't replicate at the high level, or should it happen at the community level and the communities are the ones saying, actually we've already done this, we don't need to repeat it? I just have this curiosity and wonder what all of you think, since you're like representing the two different sides.
It would be interesting to see what the community thinks and what the donor thinks, because there's different.
Yeah,
I bet
Joseph and I are like, who gets to take this one on?
They each want to answer. So maybe Sarah, do you want to give some comments?
I'll try to keep it brief because I know there are a plurality of views on this question. And the question is, again, about where coordination should begin. That could happen at multiple levels: headquarters, country level, community level. So I'll share my experience from Ethiopia, where we are having, we're making concerted efforts to bring together the humanitarian development and peace building actors under the same rubric and framework, and how incredibly challenging it has been to achieve that aim, that objective. And this is an effort that's very much at a Addis Ababa capital level, and it's not sufficient to stop there. It absolutely needs to trickle down to the subnational level, to regions, to districts and villages. But we are embarking on this effort in 2023, and we've made some really good headway, bringing together our development partners, our humanitarian country team, and a peace-building network to look across all of the technical sectors and humanitarian clusters, identify where there can be coordination, and there are some really good examples that we're seeing already where that coordination is happening in the WASH sector. Look at the discussions around emergency water trucking, and then bring in the development partners to consider where and how they can help to rebuild or rehabilitate water infrastructure. The same type of coordination is happening in education. So it can be done, and it's so incredibly difficult. It's much more difficult than it should be, but this is the reality. And it is a priority for us, and I think it needs to continue to be a priority. And that is only at a country level, not even speaking to what coordination needs to happen at the regional level. I don't know if I go to my left or my right.
I think everyone wants to answer, but Muturi, do you want to add anything? And then we'll take one more question before
I think it can happen at both levels. So very practically, one of the projects that we are involved with, and I think Josh is here with South North, called the Voices for Climate Action, is that coordination is happening at that level. So for example, at the donor level, SDI will do a proposal, we will collect the data, we will profile the city in terms of, we'll do the vulnerability mapping, we'll do the risk mapping, we will profile all environmental groups that are working in this particular city where we have that consortium. So if South North or WWF also present the same budget, they'll be told, no, this SDI is doing this, you budget for. So coordination can happen at that level. But at the community level, communities are overwhelmed by all this data collection, and to kind of respond to that, what SDI is doing is to develop a tool with other stakeholders that how do we collect this information with the city and other stakeholders, where we have a platform where this data can be accessible to anybody who needs this data. One of the things we realize is that even cities depend on the census data, on the National Bureau of Statistics data, which sometimes is 9 years old, 8 years old. We had a case where We are involved in a country program where somebody presented data which was, and when communities presented their own data which was 2 months old, they said, no, we will use that one. So it can happen at both levels. But like I said, there's a lot of, everybody has a budget for data collection. Every organization has a budget for data collection. Every donor wants to fund, because at the end of the day, for you to justify this project you are going to do, you have to build some level of evidence. This is the situation, how terrible it is. You have to show numbers, you have to show pictures. But I think there's a way, like I said, there's so much duplication. Coordination can happen at the donor level. Coordination can happen if we create a consortium or a partnership at city level, national level, civil society level. And I think, how do we build the capacities of communities to collect that, all the information that is required, and this information can be made accessible, whether it's health data, education, resilience data. So it can happen at both levels. Probably let's hear from the other donor.
I think we'll hear from Kai, and then we're going to break into our breakout groups for just a few minutes, because I'm just conscious of the time.
Yeah, I'll try to put on the donor hat, even though GIZ is not a donor. But we're working for the donor. I think that's a really good point, and that's exactly one of the key pivots of the Global Shield in comparison to what InterResilience was before, that we move a lot of the coordination from global initiatives that are like coordinating themselves, but there's no like central coordination, to the country, so that work is coordinated in the country, and then in that in-country process where best case all stakeholders are involved. So Joseph would be invited to bring in all the SDI knowledge, all the risk analysis that has been done already, and bring it to the table. So really the coordination should take place at the country level for the Global Shield, so, and also under country ownership. So there will be an in-country coordinator who's part of the government to kind of own the process and to guide the community through it. And so I agree, coordination has to happen at all the levels, but I think if we move significant chunks of coordination into the country and into the communities, I think we can really improve the work that we're doing.
Thanks so much. Okay, so we have until 12:30 for lunch. I mean, lunch is at 12:30. So we have about 25 minutes. We might run like 5 minutes over because we started more than 5 minutes late. So just as a warning. But let's break into small groups. So I would suggest, we were supposed to have tables, but nevertheless, we'll do what we can. Let's just kind of move into, I don't know, corners with the people that you're kind of sitting close to, I think is the easiest way to do it. And we're gonna put, I think, if we can move to the next slide, I think we have the questions for discussion right there. So I'm going to ask that each of the panelists, that one of you go to each of the groups and try to kind of, kickstart some of the conversation on these questions. So we have a question on implications, a question about distilling some of the principles that we talked about this morning, and then what's next. And we talked a lot about whether we should do these groups or not, and we decided that the input is going to go into this evidence report that's coming out of this conference. So you're not just doing it like for fun, I think people are like, I was worried people are going to be a little bit like sick of breakout groups by this point, but this is maybe some good incentive that you'll report back. So we'll have about 1 to 2 minutes for each group to report back. And what came out of your groups will be used as part of the inputs into the evidence report coming out of the conference. So that hopefully will incentivize the conversations a little bit more. Okay, so let's do that. We have about 20 minutes. I'm gonna use Karina's method of putting my hand up when there's like 1 minute left, because it takes about a minute or more to get everyone's attention. So if you see me standing up here going like this, yeah, it's just a signal to wrap up your conversations. And then we'll ask either the panelist from your group, or you can nominate someone else to just give the last kind of the report back before we wrap up. Okay, so off you go into your groups. Thank you. 2-minute warning for all the groups. And don't forget, someone has to report back, so. Okay. I'm going to ask everyone to please wrap up so we have time for report back and you're not too late for lunch. I can see people are still talking. So that's a good sign about how interesting the session is, but this group, they're very rebellious over here. These guys with their flip chart. Hi. Thank you. It's such a non-violent way to get people's attention. Okay, so I think maybe we can stay seated. I mean, I don't love being up here all by myself, but maybe I can grab the mic and then there we go. Okay, so yeah, if each group, whoever you nominated to do your report back, if you could just give 1, maximum 2 minutes report back. Karina, is this being recorded in some way? Okay, cool, great. Okay, so let's just do those quick report backs, and then Shuchi is gonna wrap up for us and say thank you, and then we'll all go eat our lunch. Which group would like to go first? Aha, Sarah. Great. If we could, would you mind just going back to the slide that had the questions, just so we can have those as a reference point while we're talking? Thank you.
Okay, so for our group, we did not progress beyond question 1.
Aha. That's fine.
But it was such a fun discussion. We wish you were all part of it. What we observed was that co-creating, we were really picking up on this theme of co-creation with the community and a true partnership, working with communities, and how there is a perceived distance or different perspective for the donors who have very rigid timelines and finite resources and are implementing these programs according to a program cycle. So it could be seen as removing the human community element in our programming with our fixation on the numbers rather than the human experience. So in regards to that, that need, we offered a recommendation in having stories become an acceptable form of reporting. One of our participants shared how she was able to influence USAID, the donor, and the reporting format, which placed Jessie at the front of the reporting document, and how over time they were also able to change their theory of change and the indicators, and began, as a result, seeing much more intentional focus and resources going to a Jessie agenda. So really seeing some positive traction there and promoting social and inclusive development. And of course, from the beginning, this retrofitting could be avoided if communities were involved in the design of the activity from the get-go. And if communities were asked what their needs were and what they wanted to see in response to those needs. So participation on paper, not sufficient, whether it's the government, whether it's the donor, really maybe even standing quite firm with conditionality in conversations with governments and donors about what it does mean to bring community voices into that process. Thanks.
Thanks, Sarah. Thank you. Those are some good takeaways. Who would like to go next? I think Kai, I saw your hand up.
Yeah, I think I had his hand up. Sorry.
You'll all get a chance.
Yeah.
Don't worry.
Thank you. I'll try to be short.
Thank you.
Yeah, we had a good discussion in the group, and a really illustrative example from Zambia, where we heard that recent research findings were presented to senior policymakers to kind of develop a vision for the country, and that's something that really stuck with me. And then we mentioned a lot of points on making the whole process participatory, meaning both participatory for communities but also for policymakers to really integrate knowledge generation among those stakeholder groups. And that there's also a need for better evidence on coordination, both within the countries and also cross-border, and that we really need better intermediaries or knowledge brokers who get the knowledge out. And the principles that were mentioned in the discussion, I don't know if they really match the principles that we have seen. I don't know all of them by heart. So what I heard was co-creation or co-design, participation, dialogue orientation, demand orientation, and that for all of them, time can really be a key constraint, something I experience in my work as well, so it really resonated with me. And on the advocacy part, it was not allowed to say COP. So one point that stuck with me was like sharing all that in our networks, because here in this room we got a lot of people who have great networks and work in very different bubbles. So when I came, I was really happy not to see many people from the insurance bubble, because I thought like, yeah, this is cool to poke my bubble. So if we go back to our bubbles and take what we learn here, I think we do great.
Thanks so much, Kai. Also some good takeaways there. Lucia, Cara, I saw both of your hands up. One of you from this group.
Shall I start? then I pass you. Yeah, so, I mean, of course, yeah, we wanted to go after you because of something very similar that we also talked about, which is this need for co-production of evidence, but we also talked about one of the challenges that comes when projects are designed in advance, and as they normally are, and therefore the need to change systems so that the projects themselves can be designed more collectively and in a more co-produced ways, so that already at the onset there is, yeah, there are those voices that otherwise will only come in too late, and different types of evidence will come in too late. We also talked about the importance of, yeah, distinguishing between data and evidence, and how agreement must be had by all of those involved in these processes, like co-produced processes, about, yeah, what is, let's say, the final result or something. Although, yeah, maybe that it won't be there. We also talked about the importance of connectivity and coordination, which is still quite limited, so it goes back a little bit to what we were talking about, at which level that should happen, and, yeah, the need for it. In terms of principles, we talked about the need to yeah, collect evidence that is fit for purpose and that adds value for the communities and for the final use it is meant for. I think, yeah, co-creation itself could also be a principle. Coordination is all tied to it. And maybe in terms of the last one, we were really saying that, as you also said, there is a role for all of us to yeah, to bring these conversations forward and to try to bring about changes in the way we're doing things in the institutions. So changes about how data is collected, how it is used, how it is shared. And of course, yeah, that could be done through the different fora where we participate, but yeah, as you also said, through discussions. I don't know if you wanted to maybe add anything.
I think you captured all of it. Yeah, thank you.
Anyone else? No.
Thanks. And last but not least, Julio, great.
Yeah, I'll try to be brief. Okay, so there was a range of things that we discussed mainly around the first question. And this kind of goes into one of the points that I had on the issues around filtering evidence upwards. So there's an example of how this happens often with things like justice and equity. And that often gets lost in the translation of shifting from the community level to the national level. And really, you know, there's a question of how serious are we actually taking this within the policy space. So on there were a couple topics on data collection, and there's you know, a couple points around having dedicated funds for community data collection. The community is obviously highly important in that data collection, and there needs to be an incentive for them to engage and continue this process. And the process, you know, it shouldn't be limited to program timelines. It's something that should be built into the system, so it's continuously being updated. And then there's really just a question of how do we create that type of sustainability. Also on the data collection, there's still perception, and I guess it's a question of whether it's reality, is that the data collection is still driven by the donor priorities. And this is something that you know, we do need to change if we're going to be doing that type of work more effectively. And you know, this also feeds into another point that came up around, you know, we're engaging with the communities, but if we look at everything as a kind of holistic system, if you're engaging properly, you essentially become part of that community doing all of the work. So we shouldn't see these stark differences between the various groups engaging. And perhaps if we can kind of come to that type of understanding, then things may change slightly. There's also a couple points on understanding the political process. This is, you know, not always well kind of grasped at the community level, and understanding how you can push information across. There was an example of a project that brought in a policy advisory group, and they essentially mediated between the communities and the policymakers as these kind of high-level champions that had the respect of the policymakers. And I guess in that respect, it's, having the community speak directly to policy may not always be the best fit. It's around how do you understand that process. Yeah, and this kind of goes into the question of, what are the pathways that we need to go through to engage with and influence government and policy. And, it's not always clear to those on the ground what is the correct pathway. Anything else?
Great. Lots of good reflections. I'm glad that the breakout groups were a smashing success, yeah. So that's great. But really, thank you all for those rich discussions and lots of great points, great recommendations coming out of there. It's really nice to be able to take a lot of what's been discussed over the past couple of days and the principles and priorities we workshopped a bit this morning, and not only hear from the panelists on their experience, but also get experience from the room and from all of the people who are here today. So I think I'm really glad that we had the opportunity to do that. We are pretty much finished with our session at this stage, and it is, thank you also for being willing to stay a little bit into lunch. So I just really want to say thank you to our panelists, again, for your contributions. It was a really great panel, lots of diverse perspectives, so that was great. And to all of you in the room as well, even more diverse perspectives to contribute to this rich discussion and session this morning. And yeah, thank you all for being here. And we will see you, what time is the plenary? What time are we? 1:30 sharp. So 1:30 sharp in the same room we've been in, right? Yeah. To leave, and that's not fun at all. Okay. So 1:30 sharp, off you go for lunch now, and then we'll all meet back in Hall D at 1:30, which is in just under an hour. Thanks, everyone.